So we're going to have a couple sections on birth injuries now. And first we'll talk about skeletal injuries. Skull fractures are rare in delivery. When they happen, they're more likely to happen because of forceps that are not used correctly, or the pressure of the head on the pelvis in an obstructed labor. What can happen if there's a skull fracture? It can disrupt the arteries under the skull and lead to bleeding and cause increased intracranial pressure. A linear skull fracture is just a straight line and everything is still approximated, and it usually heals without intervention. Depressed skull fractures are a little bit more common, or a little bit more serious. They're less common, but they're a little more serious. And it can, again, that's usually from either an obstructed labor where the uterus just keeps trying to push and the baby's not budging and the head is pushed against the pelvis, or they happened at times in the past from forceps. Clavicle fractures, probably the most frequent birth fracture. It's definitely the most frequent birth fracture. It's possibly the most frequent birth injury. It's often related to dystocia. The baby's not coming out easily, and so somehow in the process of getting that baby delivered, the clavicle is fractured. What does it look like? Then the baby is not moving that side. You have a newborn. One of the things we're assessing is, do they move all of their limbs? If they're not moving one arm, assess the clavicle. We also want to palpate. If we palpate crepitus over that bone, we would also be looking into a clavicle fracture. Clavicle fractures usually heal quickly. They're treated by immobilizing that limb against the chest. The baby needs to be handled gently. Sometimes the parents are afraid of handling that baby because they're afraid of causing more injury. So we want to coach them through handling that baby gently while it heals. Humerus and femur fractures are less common. They can occur in a difficult birth, especially if there's a compound presentation. If they need to be reduced, they're reduced and immobilized, and they usually heal quickly in infants. The next recording will be about some nervous system injuries.